Hi there, my name's Adam Jackson. I'm an ambulatory vet here at Liphook Equine Hospital. We're also known as roadies. And I'm just going to do a really small discussion on the different pieces of equipment that we use to evaluate and rasp your horse's teeth in order to provide good dental care. Let's get started. The first thing that we need to consider when doing dental care for your horse is the facility, the area. And it is really good to try to do it in the stable that belongs to your horse, because hopefully that will reduce the anxiety that they may feel because they're in their own space. In addition, it would be really good if the ceiling could be high and there is plenty of space in there so that we have movement for the horse and for the handler and the teeth rasper. Any extra stuff that's in the stable, such as feed buckets or water buckets or hay nets, they should come out. Get those out the way, because they can just get in the way while we're trying to do the teeth rasping. And also, if there's any extra people that do want to watch, that's absolutely fine, but it would be really good that they're outside the stable, well away. They can watch from a distance, just for safety purposes. The additional thing is, we just would like to have access to clean water and electricity, because sometimes we use electrical teeth rasps. We often use these various products, and there's lots of products on the market, to sedate your horse. And it's not a bad thing to do, just sometimes horses do get worried, and it is to provide safety for your horse, the handler, and the person doing the teeth rasping. So these are various drugs that we use that we will medicate, inject intravenously. We often use headstands. It's really helpful when taking care of your horse's mouth. And we particularly use it if we have to sedate your horse, which is not often, but sometimes we have to do it just in order to do a good, thorough job and have a good examination. And the nice thing about these headstands is they're padded, so the horse is comfortable when resting their head. They have this material that's easily cleaned, so in between horses we can clean it. It stabilizes the horse, and also it does adjust in size so that we can accommodate a little Shetland pony or a huge draft horse. Keeping the procedure as clean as possible is important. Obviously it is a bit messy because we have lots of leftover food in the mouth. But like I mentioned before, we'll use a dilute Hibiscrub. We'll put it in the bucket. And then you can see the vets tend to use stainless steel buckets so that we can clean them down and wash them down easily between procedures. And it holds our rasp nicely, and we have a little brush inside the bucket, so as we're cleaning our rasp, we can give it a quick brush and clean everything off. When we have the gags in, there still may be some food in there, and we need to get that out so we can have a really good look at the teeth. So we use this nice syringe. We usually mix it with water and Hibiscrub, a dilute Hibiscrub solution, so that we can rinse out their mouth and get a good look. And the nice thing about this syringe is you can see it has a round tip at the end, so it doesn't cause any trauma to their gums or any other soft tissue structures in their mouth when we're in there flushing. Before we even start rasping any teeth, we like to have a really good look in there. And there's lots of different specula out there that allow us to inspect your horse's oral cavity, but there's two main types that we tend to use here, although we do have an array of different sorts at Liphook. First of all, you probably recognize this. This is the Houston gag or McPherson gag, and that just the leather piece goes behind the ears. The incisors sit on these brackets, and it allows us to gently open the mouth so we can visualize the mouth properly. But the one issue with this is this does not really allow us to look closely at the incisors. So that's when we can use this gag, which just slides up the side of the horse's mouth, and the cheek teeth bite on this nice rubber bit so it's comfortable for the horse, and it allows us to inspect the front teeth or the incisors. When we do look in the horse's mouth, it can be dark in there, so it's good to have a head torch that we'll place on top of our head, so it leaves our hands free, so that we can have a really good look inside your horse's mouth. So we often use a mirror to have a really good look inside your horse's mouth, which you can see in the center there, with the round top. And then you can see all the items around the mirror, which is exactly the same as what your own dentist would use, are dental picks. So it allows us to evaluate the teeth, looking for any sort of periodontal damage or any sort of diastemas or any problems with the dental cavity, and also to locate any signs of fractures. And like I said, it's exactly the same sort of tools that your dentist would use on you, except they're just on a larger scale. Now we actually get to the teeth rasping part, and as you can see, we have lots of different size rasps. These are only just very few, a small selection of different sorts that we have. And it allows us to get to different teeth in different parts of the mouth, some tight parts of the mouth, nooks and crannies that are difficult to get at. And we can see that they do have a blade which allows you to rasp the teeth and really helps with that job. And they're very good, but sometimes we do need to use electrical teeth rasps. Sometimes we need a little bit more oomph when we're doing the teeth rasping, and that's when we use electrical teeth rasps. Now, we used to use these, and these are the old style, and you can see it's actually a drill, that's all it is. And then we have a special dental unit that fits, a dental float that fits on the end, and has a rotating cusp. And these are still very handy, and a lot of vets will use these. And it's battery, which is nice, so you're free. But they are a bit big and bulky. At Lip-Hook, we're very fortunate. We have these nice little units here that just click around our back, and they're battery powered, or mine happens to be electric, but a lot of the vets have battery powered. And then we can put various units on the end so that we can rasp the teeth, and we have rotating ones and apple core ones, which Tim Adams mentioned. Various different types of floats to deal with different problems in the teeth and to get to different parts of the mouth. So there are some situations where we have to remove some teeth, or teeth fragments, or fractured pieces. And we use these great big things. These are specifically for cheek teeth. So we'll put this in the mouth, which allows us, and we try to get it around the tooth that we're trying to remove, and spread the space between the tooth we want to remove and the opposing teeth. And then we'll place on the molar extractors, and we'll gradually manipulate it very gently. You have to be very gentle, one, for the comfort of the horse, and two, we don't want to fracture the tooth or anything, fracture the jaw or anything like that. So we do it very gently, and with time, it does come out nicely. And we also have little kits to remove wolf teeth if they're causing a problem with the bit, but we only remove them if they're causing a problem. In the last 5 to 10 years, there have been huge advances in dental care in the horse world, and Lip-Hook have been a big part of staying up to date with those advances and using these new techniques and new equipment to provide your horse with the best dental care. I hope this talk has been helpful, and if you have any questions, again, by all means, just contact us at Lip-Hook Equine Hospital.